757.
With the power of Tandem HR, you are in the fast lane on Main Street with Get Down to Business with Shalom Klein, the show for business and jobs. Now, the champion of networking, the advocate of jobs, the guru of business, your host, Shalom Klein.
We are all about small business, jobs, and entrepreneurship and business. We talk a lot about business here. You're on with Get Down to Business, and I'm your host, Shalom Klein. Remember, you can always download podcasts from Get Down to Business on my website at shalomklein.com. And while you're there, don't forget to follow me on Twitter at Shalom Klein. It's going to be a jam-packed week of content and information that you won't want to miss. It's a live show. That's right. You could call us at 312-642-5600, 312-642-5600. Get Down to Business is powered by Tandem HR, your solution center. Give them a call with all of your HR, all of your staffing, all of your payroll questions and needs. You can find them online at tandemhr.com or give them a call at 630-928-0510, 630-928-0510. Do yourself a favor. Give Tandem HR a call, 630-928-0510. This week, we'll be joined by some fascinating guests, including Dr. Barbara Ross-Lee, who is going to be sharing with us a little bit of information about America's growing doctor shortage. We're going to be talking a little bit about the Democratic debate that is taking place as we speak. We're going to be talking about the arts, and we are going to be discussing public relations. You don't want to miss it. It's a live show. You can call us 312-642-5600. First up on the program, as promised, is Dr. Barbara Ross-Lee, a distinguished medical expert, a policy leader, and dean of the NYIT-Com at Arizona State, and thrilled to have Dr. Barbara Ross-Lee on the program discussing America's growing doctor shortage. Doctor, welcome to the program.
Well, thank you. It's a pleasure to be here with you.
So there's no question that this issue is not discussed enough. Everybody understands that healthcare is changing. Everybody understands the mergers, the acquisitions of the hospitals. Certainly here in the Chicagoland market, it's a frequent topic of discussion. But the doctor shortage, doctor, tell us what is going on.
Well, I would be remiss if I didn't correct one thing. Actually, I'm the dean of the NYIT-Com Medical School at Arkansas State.
Arkansas State, there we go.
Arkansas State University. Okay, well, there's the experts are divided on exactly how they're defining this shortage, but there is an absolute shortage of physicians, and it's growing. Either some people think it's just based on the number is wrong. We need many more physicians in general. Others think that it's more based upon the distribution of physicians. They're maldistributed geographically across the country because we have some parts of the country where we have whole counties that don't have a physician.
And is it the primary care doctors that are primarily the shortage?
And actually, it's probably broader than that. But again, that's the third aspect, is that we may have enough physicians. Even if we do, we don't have the right kind of physicians. We don't have the generalist physicians like family medicine, general pediatrics, or general internal medicine. And these are the physicians that practice most of the primary care.
So how did this problem come to be? And obviously, I'd love to hear your suggestions. And it sounds like you've done a lot of work in the area of identifying a solution.
Well, the problem has grown out from several directions. One is the government put a cap on the number of residents that they would train for in medicine, which meant, therefore, that the population, the number of physicians, could not grow beyond that cap unless they found some additional funding. And some of that is occurring. But that cap is stifling to the growth in the number of physicians. And then, of course, the system itself rewards specialists, the procedural specialists, much more than the generalists. And what we really need are the generalists. So the system, the educational system, isn't aligned with the needs of the population.
Interesting. So the New York Institute of Technology launched a new program on the campus of Arkansas State University.
Right.
Tell us a little bit about the program.
Well, Arkansas is one of those states that is suffering from a shortage of physicians, and that's part of the motivation of NYIT to become involved with Arkansas State University, because it's a cost-effective way, quite frankly, and kind of a public-private partnership to be able to address the health needs in Arkansas. Arkansas, if you rank the health status of the population, number 49 out of 50 states.
Wow.
If you rank them based upon shortage numbers, number 47, 48, 49 out of 50 states.
So certainly the need is expressed in areas like Arkansas, but what you're telling me, again, we're talking with Dr. Barbara Ross-Lee, that there is a shortage of more than 20,000 primary care physicians over the coming years, and that is a national concern. And obviously the solution in Arkansas is a part of the solution, but there's a growing trend, it sounds like, around the country to try to address that need, and the latest being in Arkansas. Tell us about the new colleges and the new programs that have been opening up.
Well, actually, I'm at an osteopathic college. The osteopathic profession is one of the fastest growing health professions in the country. But every single, and the osteopathic profession tends to serve rural and underserved communities. And so, to a large extent, we've seen a growth in colleges of osteopathic medicine, as well as colleges of the MD colleges, in an effort to try and graduate more physicians who could then be placed in the system of care where there's such a shortage. And I agree with you, absolutely. There are shortages in communities in every single state in this country.
No doubt that many of our listeners are hearing what you're saying, blown away by the shortages of physicians, but also hearing the news and watching the stories that are out there of the challenges of Obamacare and the issues relating to the insurance requirements that exist. Is being a doctor a good job these days?
Well, physicians they're change fatigued, because there's a lot of change going on in the system. And these changes, while increasing the access to health care for many parts of our country, at the same time have an impact on a population of physicians that's not growing fast enough. Mm-hmm. So we have confounders. I mean, the complexity of care of the system as we try to control the cost has become unbelievable. It's extremely difficult to navigate your way through the system. Quite frankly, we've created a new profession, and they're called patient navigators. These are people who do nothing but work with patients to get them through the healthcare system, right, because it's become so complex. The second part, of course, is we've always been concerned about quality, and the electronic health records are a major attempt to, kind of communicate between physicians in a way that's understandable and document the healthcare needs. But these electronic health record systems are increasing the administrative load for physicians, and so they can't see as many patients as they used to see because they have to handle the electronic medical records.
And let's face it, many of our listeners know I love to talk about entrepreneurship. And the reality is that many of the physicians that are coming out of the programs that you just mentioned, Doctor, are not going to be setting up their own practice. They're going to be working for the large hospital groups that are increasingly swallowing up all of these smaller groups. So, so the medical profession has certainly changed, but it sounds like you are at the forefront of changing it yet again, making sure that there won't be a doctor shortage, making sure that that folks that have needs have access to the care that they certainly require. So, Dr. Barbara Ross-Lee, once again, a distinguished medical expert, policy leader, and dean of the New York Institute of Technology at Arkansas State. University. We appreciate your time. Doctor, is there a website that you can point our listeners to learn more about the osteopathic approach and the new colleges that are popping up?
I would suggest it's aacom.org, and you can find out all about osteopathic medicine, all the new schools, and kind of, what the profession is doing to increase the number of primary care physicians.
Fantastic. aacom.org. Dr. Barbara Ross-Lee, we appreciate your time, and certainly this is an issue that's not going away, so certainly we will be in touch, and we'll continue this conversation in future weeks. Thank you. Enjoy the rest of your weekend. After the break, we will be continuing the discussion about current events and a little bit of this healthcare debate that's taking place as we speak at the Democratic debate. And here to join me is producer George, who will be sharing his thoughts, and he's got a lot of them. You're listening to Get Down to Business.
Stuck?